Hello everyone, this is Shazad here, and you're watching my YouTube channel, Shazad from Canada. One of my students asked me a question, and she's actually preparing for NCLEX RN exam. And the question was how patients with heart failure, when we give them digoxin, how their heart rate decreases, and how the blood pressure improves with the use of digoxin. So this reminds me the thing that this question is actually related to the mechanism of action of digoxin, like how digoxin work in patients with heart failure. So I thought to quickly make a small video so that other people who are preparing for NCLEX RN exam, they can also get benefit from this. So how digoxin improves blood pressure and decreases heart rate? To understand this thing, first we need to understand two important terminologies. What are those terminologies? The first thing is inotropic effect. So we need to know what is inotropic effect. So inotropics are actually the agents or the drugs that enhance the contractility of heart. These are the agents that improve the heart's contractions. So as we know that in heart failure patients, the heart contraction is not adequate, and because of that, the ejection fraction is also low. There could be several causes that can lead to heart failure, but the eventual result is like heart is not contracting forcefully. The force of contraction is reduced, and due to that, the cardiac output is not enough. So these are the agents that improves the contraction of the heart. So anything, any substance that improves the contraction of the heart is actually inotropic, and their effect is inotropic effect. The other thing is chronotropic effect. So chronotropic is anything that basically reduce the heart rate. So digoxin has a mechanism of action that is positive in that has positive inotropic effect and negative chronotropic effect. So this is how digoxin works, and improves and the blood pressure. Why? Because when there is increase in the force of contraction, by increasing the force of contraction, there will be increase in the stroke volume and cardiac output. Therefore, there will be increase in the blood pressure. What we see with in patients with heart failure, there is decrease in the blood pressure, and because of the decrease in the blood pressure and negative feedback mechanisms, there will be increase in the heart rate. The heart is actually trying to compensate through beating fast, like there will be tachycardia. So because of that, decrease in the blood pressure, and therefore there is increase in heart rate. So that's why digoxin is efficient. How digoxin creates its inotropic effect? This is basically sodium potassium ATPase inhibition. So digoxin will inhibit the sodium potassium ATPase activity, eventually leading to the increased flow of calcium ions into the cell. So that's why the calcium will enhance the cardiac muscles contractility. So this is how digoxin improves blood pressure. There is another terminology which is dromotropic effects. Well, I'm not gonna go into the details of that, but that's related to the conduction rate right? The rate of conduction of the impulse from SA node to AV node. So yeah, this is the mechanism through which digoxin improves the blood pressure and decreases the heart rate. But remember, digoxin therapy or any patient who is taking digoxin is at risk of digoxin toxicity. So if there is digoxin toxicity, what can happen? What can be the symptom? I would like to, hear about your thoughts. So please, whoever is watching this video, if you like the video, please share this video and also comment, and I would like to hear your thoughts, like what could be the sign and symptoms of digoxin toxicity and how we need to manage that. Also, please share your thoughts about if there is digoxin toxicity, how we can treat that, and what could be the antidote of that. Thank you so much for watching, and I'll see you with another important video. Bye for now.